the Reuters report that we've been focusing on all morning also stresses it's too early to reach final conclusions about the wisdom of these policies, but it reports that many staff and managers of care homes consider that policies such as only admitting the sickest for hospital treatment, clearing out as many non-acute patients as possible from wards, huge failings in PPE supply and provision. These are based on documents from government agencies seen by Reuters and interviews with 5 leaders of local authorities and 8 care home managers. Stephen Gray is the special correspondent responsible for this story, and it's hard to know where to start, Stephen. Let's start with a very simple question of why you started looking into this.
Thanks, James, and good morning. Thank you to everyone for having me on. I mean, I started off because I wanted to look on the front line. I think that when we last spoke, we were looking at focus very much on the, Sage, Dominic Cummings and the sort of politics. And I just wanted to see what was actually happening at ground level. So we literally went out and talked to people. And it struck me that the care home side of it was obviously being downplayed because, very obviously when they first started talking about deaths, they didn't mention care home deaths. They were talking about only people who died in hospitals. And, as the data has unfolded, and if you saw there, it's absolutely staggering that we now believe that at least 12,000, we think actually the figure is 15,000 people by April 24th, so that's not even the latest figures, more excess deaths in care homes. That's more people, 15,000 more people have died this year in care homes because of this pandemic, which is absolutely staggering. And that even doesn't include, I would say, almost half the people who die in care homes who, when they get, sick, do finally get admitted to hospital and die there. So it's
of course, so some of the hospital deaths will be care home residents.
Exactly, and there's figures they haven't yet released, which they do have, because they do actually track everybody who's looked after in care homes to see what happens to them. And the figures they haven't released is care home people who die in hospital. So actually the overall picture is going to be staggering. And, I was also just very struck by that phrase, protect the NHS, because of course we want to protect the NHS, and that's really important. But you know what? That's only a second line goal. It's all there to try and support the main thing, which is to protect lives and to protect the most vulnerable. And I felt that there's always a danger in public policy when if you have a single mind focus on one thing, because it always distorts the outcome. It always means that, you will put that maybe ahead of something else. And it's, and finally, if you like, the final piece of the puzzle, you've mentioned that what we was really struck by, and I've spoken to lots of people who've lost their loved ones over COVID-19, as well as lots of care workers, and I was honestly in tears when I heard a lot of these stories. But what the sort of picture that comes through again and again is the difficulty of getting into hospital, and how I remember talking to a consultant in the weekend of Easter Sunday, and they were saying, how eerily quiet it was and how few people were coming in. It's like the crisis had peaked, but she had this little concern. So they were all ringing each other up around and saying, is that because they're not sending people to us, And it turns out that at that very time, care home deaths were still on the up. They were still raging. And the last figures that, every week has been higher than the next. And the last figures that came out, which are only up to April 24th, still show them rising. So
what explains that, do you think? I mean, because there's a difference between policy and conduct, isn't there? So why would the people running the care homes not be trying to get their residents into hospital if they feared or if they knew that they were sufficiently poorly?
Look, there's multiple things here. I mean, for some people, obviously, that's where they would if they really have little chance of survival, and where it's not thought that hospitals do any good, that may be the place that they wanted to end their days. And it may also, because obviously there may be a better chance, for example, for relatives to see them, even though that's difficult even in a care home. So there are good reasons sometimes for not sending people to hospital, particularly when there's no particular treatment available other than oxygen. But that oxygen is important.
So that's like a managed departure from from this.
That's right. Well, it's just, managing the odds, it's not necessarily they're definitely going to die, but it just may be that that's how they want to play things out. They don't want to, have tubes stuck down them or whatever. They just may want to take their chances where they are. So that's one thing. But beyond that, the disturbing thing, if you like, is just the sort of pressure put on care home managers to sort of play their part in some kind of national effort to protect the NHS. And you see that in the guidance, sometimes it's given, sometimes it's withdrawn, but the general impression that these people were given was that, do all you can to stop admissions into hospitals, which is quite frightening, really.
And then the even more poignant element of your report then moves inevitably from the residents of care homes to the staff. And I mean, again, it's very hard to pick a paragraph that sums things up best, but the home in which the worker that you begin the story with her mother struggling to find the words to tell her daughter that she's dead. The first test of a resident took place on April the 29th, 34 days after the first suspected case at the home, and 14 days after Matt Hancock, the UK Health Secretary, pledged that tests would be available to everyone who needs one in a care home. And you quote an executive from Care UK, which owns Elizabeth Lodge in Enfield, as saying that the government's response on testing has come way too late to have any meaningful effect on keeping the virus out of our homes. And I mean, you must be doing this a bit as well. The more sometimes that you read reports like yours today and others over the last few weeks, the more you wonder where the grown-ups were or where the alarm bells were. I mean, this has been unfolding inexorably under our noses, and it's only in retrospect that we get a proper handle on the scale of the tragedy and arguably the scale of the scandal.
That's right. It reminds me a bit like when I covered the wars in Afghanistan and Iraq, where you sort of go to ground level and you hear stuff that's just completely at odds as to what's being said by the generals, and at the ground level, people say, and literally when you speak to these people in the front line, I'm talking about care home workers, and on the radio it's saying they're all going to get tests. There's plenty of tests available. Or I remember one morning that it said Matt Hancock said on the radio that that there weren't enough people applying. Essentially, that there wasn't enough take up. And when you speak to care home workers, they say bluntly, that's a lie. I mean, they've said it again and again, and I've been doing it for the last 3 weeks. The disconnect between what's said at the top and what's happening on the ground. And I don't know what information the leadership of this country has or who they talk to, but clearly sometimes the ground reality is not getting through to them. And it was, I mean, I had to ask this care home, Elizabeth Lodge in Enfield, the managers. I asked if it was a misprint. I just couldn't believe it, to be honest with you. When I got a reply, I asked, when was the first test of a resident at that place? And bear in mind, this is one of the largest outbreaks in the country that we've heard of so far. I think there's one higher in Scotland. That's it, as far as we know. In terms of deaths, 25 people have died there, of which 18 confirmed or are suspected to be linked to COVID, which is about a quarter of the people in that home. Now,
how many staff? Is it just Sonia who's?
I don't know if anybody else has been infected. Sonia's the only member of staff, thank goodness, who has passed away. And I really feel for them in trying to manage that. But do you know how difficult it is anyway? It must be incredibly difficult to manage that kind of thing. And if on top of that you haven't got the basics, you can't even test the residents to work out whom, perhaps should be separated from others. It's an incredibly difficult environment anyway. And to not have those basics, but also for it to take so long, even when the promises were out there. And again, I don't know who the care home staff and managers, talk to try and get these tests, but, they say that they actually spoke to government ministers. So there are still a lot of questions there, aren't there?
There are. And finally, something I don't know whether I'd missed it or whether I've forgotten it or whether it's been crowded out of the coverage, even for those of us who do it for a living. But this document that was withdrawn within 5 days after public criticism, the one that essentially gave care homes the impression that residents who should not ordinarily be conveyed to hospital unless authorised by a senior colleague. This came from an NHS England policy document, and then it got withdrawn 5 days later. It sounds to me as if that hung around for a lot longer than the document did. That idea hung around a lot longer than the document did.
Well, that's right, because if you remember, every kind of government for top-level guidance, it gets translated into local instructions, and some of these things just stick around. And it seemed to reflect also a national kind of impression that was that CARES were given. You know, do your bit, help the hospitals to be protected, when that really wasn't the top objective here. The top objective is to, have a health system that protects the maximum number of people from this virus.
And of course, by way of an addition to this conversation, Sonia Kagan was buying her own face masks on Amazon before she died, which is an experience that does seem to have been repeated up and down the country, not in all care homes, of course, but clearly in this one.